We've got the Mirror, and it's fairly similar vein for most of the other papers. And they're talking about, what else, this time of the year, NHS. And they're stating it's an emergency care meltdown. Queues of ambulances at the Huzzy. And there's a guy, Dr. Boyle, is basically saying that he thinks up to 500 people a week could be dying due to the lack of emergency care and the delays. And that the A&E casualty could be the worst on record this winter. This is a recurring thing over the years. Each year there's warnings, sometimes dire, sometimes not, that it's going to be bad in the health service. The sort of anecdotal things that you get in the media seem to be pointing that it's bad, and it does not appear to be getting resolved or getting put right anytime soon and anytime quick. This guy is at the Royal College of Emergency Medicines. He's a doctor, and it's Dr. Boyle. It's hard to know what the government's doing, apart from blathering on about things. The only way is if there's tangible changes. I haven't got the facts and figures, so it's difficult to compare with last year or previous years as to what's been going on. But if this guy is anywhere close near, then these are quite concerning numbers of people. 500 a week, it's 2,000. Another couple of months of winter, you're looking at 4,000 people. It's more people than died in some of these big attacks. There's no reluctance, I would imagine, in the bulk of the people in the UK that the government should spend more money on the NHS. There seems to be a reluctance on the part of the government to curtail its excessive spending in other areas to accommodate that. The government seems to have loads of money just basically dripping out of its pockets for various schemes and various adventures, foreign or otherwise. But the surveys that come through time after time after time seem to indicate that people in the UK's priority is aligned with 2 or 3 basic things. Schooling for their kids, jobs, decent, reasonable paying jobs, and a functioning and working NHS system. All these other ancillary things that get added on, realistically, for most people on surveys, don't seem to make it into the top 3. You have things like this Ukraine border dispute, war, whatever you want to term it, which leaps up the charts, and for a couple of weeks it gets hammered in the media. And it becomes a focus of attention and stuff. And that tends to divert the government's attention from the main things. I keep saying them. Education for their kids, decent, reasonable paying jobs, and a functioning and working NHS system. If you can get those 3 things going, then you've got a reasonable sort of country. The NHS is getting hammered with the timing and people having to wait for excessive amounts of time to get seen. How do you resolve it? Is it just a matter of flinging more money at it? If you did fling more money at it, would that change things? Well, in most cases, people would say that it would have some effect, sure. It would allow you to hire more people, more medical, frontline staff, allow you to build out new hospitals, new facilities, whatever. Where's the bottlenecks on this, which is preventing this happening? Some people say it's the government, the Tory government, wanting to starve the NHS of certain things so that they can hive out certain elements of it to private corporations to do things. Do you just keep paying money in? How do you resolve it? Boris had these fine sounding ideas of more doctors and stuff like that. I don't believe that the numbers that he quoted have actually happened. So another failed prime ministerial jibber jabber talking the talk without walking the walk. Now, okay, he promised hospitals as well, but sometimes these take a few years to get built. But this doctor, Dr. Boyle, he's president of the Royal College of Emergency Medicine. So he, realistically, you would say he's a bona fide expert. The other thing is that he's put his name to this. So it's not a government minister or a faceless person from one of the health services, you know, a spokesperson from them said this. This guy's put his name to it. Normally when that happens, if people don't put their name to it, you should be skeptical because they can hide behind that. He's put his name to this, Dr. Boyle. And he's saying that that it's a bad flu season was putting pressure on services that were already. And I think this is the main point, is that the services are critically overstretched. The flu season happens every wintertime, so that's expected. I think what's not expected is that you're going into these wintertime periods with your normal operating systems either undermanned and overstretched. Your personnel are worn out. Some of them have left. There's a staffing problem in the NHS. I've seen some figures, I can't remember them, but it was over 100,000 people down. Now, I'm not too sure if they were frontline and medical people, i.e. doctors and nurses and that type of person, or whether they were ancillary people or admin people or administration, other types, cleaners, people working in the laundry, all of these people which are needed to make the hospital function. So there's the other 100,000 frontline people, you know, people that are hands-on patients, people that are putting the inoculations, putting the bandages on, you know, cutting the wounds, stitching people up, doing the x-rays, all of that type of stuff. Or is it a mix, you know, that you just, why can't they get the people? Is it the rates of pay are low? The nurses would make a claim that has an impact on things. Nurses are wanting to pay a rise. The ambulance drivers are wanting to pay a rise. The junior doctors are going to have a ballot to whether to strike. Some of the trusts are saying that the levels of critical things are such that they're like these emergencies where they stop doing normal operations because they just haven't got enough staff to cope with them. They haven't got enough staff to cope with the post-op people. They haven't got enough beds in the hospital to allow people to come in for these planned operations. There's not enough beds in the hospitals, or the hospital's not big enough. Have things been tightened by these management consultant people that think that a hospital is akin to a car assembly plant or something like that? Don't know. I don't have enough information on that. But I've seen things in the media with medical people saying, yeah, we've had these people in and, you know, the bed utilisation is at an all-time high and we've taken certain wards out of circulation and all the rest of it. And just think, I understand that you're trying to get good productivity and efficiency and good usage of your resources that you've got. But these people are saying that they're critically overstretched. They're not just overstretched, they're critically overstretched. Breaking point stretch. People waiting in corridors for hours, sometimes days, sometimes multiple days. If there are odd exceptions, odd times, that's always going to happen. That's just, but it just seems to be the numbers just seem to be increasing. The service just seems to be getting overwhelmed. Is it because the GPs aren't able to cope with the people and they've basically pushed people out? You can't get an appointment, you can't do this, you can't get to see a doctor. So people get on their toes and end up at A&E casualty. There's walk-in centres now where you can't get to see a doctor. Is it because we haven't got enough GPs? I don't know. GPs are saying that they didn't want to work past 5 o'clock and they just want to work bankers' hours, basically. The flow of opening times for service-related industries, and that's, in essence, that's what the medical profession is. I can remember the days when shops used to shut at like 5 o'clock on a Saturday. Then they open until 6 or 8. And we've got shops opening on a Sunday, and some of the big mega stores opened 24 hours a day for the bulk of the week. Banks opening late on one night a week or something like this. A lot of that is not required anymore because obviously you can do these things online. Doing the doctor's stuff online, you need to have the doctor there, even if you do it online. I don't know. I just get the feeling though that there's a lot of people saying that the thing is broken, and I don't get the impression that there's a concentrated, overriding urge by the government to really get to grips and then make this a super priority, or make this the priority. We've got ambulance response times collapsing. People can't get to hospital because there's no ambulances. The ambulances are there, gridlocked with people that they cannot offload from the ambulance to get into the casualty. Gridlocked A&E units, doubling up on the little stalls that they have, meant for one person, one patient, put 2 in, putting people on trolleys in corridors. Short-term measures. But if this is happening on a regular basis, then what that would be indicating is that your capacity is below what your demand is. You've got a couple of options. You can try and cut the demand, or you can increase the capacity, and you can do a bit of a combination of both. What's a realistic time to be seen in? All these measures that they're using, good measures, should you expect to be seen by in 4 hours in a casualty A&E thing? Is that realistic? I would imagine that the A&E places triage the patients as they're coming in. Or the people that's waiting excessive or elongated lengths of time, or the very low priority ones. If they're low priority ones, realistically, why are they in A&E? Are they in A&E because they kind of get to see a GP? Is that where the problem is? I don't know. But surely we've got enough expert power. We've got enough experts in the government that can come up and tell where the blockages are that can be resolved. The problem is, where do you get doctors from? The government can rustle up money, just goes to the Bank of England and just creates a digital. There you go. There's another million squids, 2 million, 1 billion. That's no problem. Where do you get doctors from? You go and study medicine at 18, 6-year course, and you've got 2 years traipsing around Aussies doing like an internship or whatever it's called. That's 8 years. If you get a big basket to give students now and put them in the hopper, there won't be doctors for another 8 years. That's 24, 25, 26, 27, 28, 29, 30, 31. Realistically, it's 2032 that you'll see the increase at the other end. 2032, if we hire some more people into the hopper, which trains the doctors. 2032. Let's go and scavenge them from other countries and attract them to our NHS from around the world. Let's get some doctors from Africa or the Philippines or just anywhere. Spain, nurses, just get them in. Yeah, that'll work short term, possibly. You've got retraining. You've obviously got a language barrier. It's a nice assumption to think that everybody in the world can speak enough English to get by. It's one thing being able to speak a little bit of English, when you come and you're on holiday and, you want a chip butty, or you want to get on the tube or buy a train ticket if they're not on strike. It's another thing if you've got a doctor and you've got a patient and the doctor has a rudimentary level of English. There's a lot of doctors retiring because their pension arrangements, that's been resolved. They can now work more and hide more money in their pensions. A lot of doctors will be saying, well, my pension's big enough. I'd rather have the time. I'm sick of working in this maelstrom of what's going on. Your pension's adequate. More than adequate for some people, less than adequate for others. Different people, different things. A lot of the doctors on the toes. A lot of the doctors on in the age group where they're just saying, I've had enough. Your pension's big enough. Some of them will be saying that. I want to make my pension even bigger and I'm prepared to put another year, 2 years, 3 years into the NHS and up my pension. That's fine. But there seems to be a lot of people on their toes. It's a demographic thing. The demographics of the UK are the same as some of the other countries. Post WW2, there was a baby boom from like 46 when the war ended and the lads came home. We decided to have families. Expected. That lasted up until the mid-60s. And then it tailed off. Work it out. People are retiring at 65, 66. It's the baby boom, people. We're working back 65 years. You're in the late 50s, people retiring that were born in the 1950s. These are more people retiring. Government has to pay pensions. Those people that are not working, that V-shaped squiggly thing with the demographics, that big bulge, is now moving into the retirement stage. People that are older need, on the whole, more medical help. These numbers are like a bell, but how do you prove that person, it was due to the staff turnover? How do you know that? It's difficult. Consequence: 300 to 500 people are dying a week is a consequence of delays, problems with urgent and emergency care. This lad, Dr. Boyle, was speaking to Times Radio, and obviously it's being picked up by everybody and their dog, as it should. Comments: the state of the health service. Thousands more paramedics, nurses and doctors prepared to walk out over pain condition. A healthcare leader doesn't say who it is, so treat what's being said is with scepticism. Why can't this person be quoted? And I said that hospitals were under as much pressure as at the start of the panic. While a senior medic, same again, doesn't tell you what their name is, so it's treated with scepticism. Urge the government to declare a national major incident. Okay, I'm not too sure what that involves, this major incident, national, whatever. Does it allow the government to give them more money? Does it mean that it allows them to have the military people operate? I don't know what it means. When people make comments like that, they need to expand on them for the general population. What's the difference between a national major incident and a national general incident, or a national major general, national sergeant incident? I don't know. What happens differently? Does it allow them to divert funds? Well, I don't know. But needs to be expanded on. What's a national major incident? Ambulance staff are going to be on strike. Nurses will be on strike. Junior doctors are going to have a ballot. If you read the tea leaves or the coffee dregs, the indication will be that the junior doctors will be voting to strike. I don't think people realise how much junior doctors are used in the hospitals, the hours that they work and stuff like that. Shift work. I've seen a survey which junior doctors, a lot of them said that I had considered rapping. That's not a good sign. For people that you're wanting to bring into your organisation and work there, for the junior doctors, mid-late 20s, you want them for the 30s, 40s, 50s, you want them for the next 35 years in your organisation. At this stage, people are saying they're going to rap. Is it they're going to rap to leave the NHS and go work in the private sector? Possibility. Or they're going to rap the NHS to emigrate and go to another health service somewhere else in the world. Or are they going to rap and do something else? If that's the case, then you're flushing 8 years of medical training down the pan. The government's also put a lot of money into training the doctors. The doctors don't have to pay the full tuition fees when they're studying medicine. so they get like a discounted rate for that tuition. I don't know. You'll get somebody saying we should be clawing that back in. If you do a medical degree, you have to sign up to do 5 years in the NHS or something, or you've got to pay the money back and all this sort of care. I'm unsure if that's a realistic way to address the problem. That just, to me, that just sounds like a get the whip out attitude without trying to find out the real causes of why people want to leave it. It'll deter some people. You'll get into a problem when you introduce it. I'm not convinced. I'm not convinced. Unless you can make the tuition free for the doctors. Then get them to sign up. Yeah, you need to commit to 10 years in the NHS and we'll train you up to doctor level. It's maybe something to think about. But that's 10 years away, that. Even if you started today, you can't get any new doctors in that system until 2032. Population in the UK has gone up. It's gone up by 500,000 people last year. That's legitimate immigration, and also there's also whatever term you want to use for people coming to the UK that the government hasn't sanctioned but they've turned up here. Use whatever term you feel comfortable with. It's 500,000 more people. In that 500,000 people, will there be some doctor? Yeah, of course there will be. Are they enough to maintain that 500,000 new people? I don't know. Ministers are saying that the continuing strikes will erode the public support for the strikers. Then you've got this rise in excess deaths. There's conjecture as to what is causing this. Then you've got Whitty. Doesn't say what he is. Sorry, he's the Chief Medical Officer for England. Okay. I kind of remember him during the planning. So Whitty is saying that Britain faces a prolonged period of high death rates because people stayed away from the NHS during the panic or could not get treatment. I'll just state that again. It says Britain faces a prolonged period. It doesn't state how long the prolonged period is. Is it a month? Is it a quarter? Is it a year? Is it for a decade? Doesn't say. But it's not good saying that, is it? Because people either they stayed away because the NHS was swamped with the panic people, or even if they turned up, they couldn't get the treatment because there was nobody there. Whitty has warned ministers that thousands of middle-aged people are dying of heart conditions. Thousands. Because they didn't get statins or blood pressure medicines in 2020, 2021. Hundreds more people a week are dying than normal. The way that they do the death things, I think, is they take the average over the last 5 years and then compare it with the current one. And is it above that? And they say, well, that's excess deaths. You would have thought, and I only know a tiny amount on this, but you would have thought, like on the death certificate, that, 101 things that you can have, like a tick list of what's been the primary cause of the death. Like some of the death things they say, old age and stuff like that. I don't know. I did a bit of ancestry, so I got some death certificates and stuff like that. The old ones of family members from in the 50s and 60s and stuff like that. Some of the stuff that's written on is not really that amount of information. You would have thought in a digitized, modern type of medical system that they would be able to, formulate, tabulate down to get a better handle, rather than just saying, well, there's more people died this month than died this month over the last 5 years. That's excess deaths. Yeah, but numbers in the population's changing, the age demographics are changing. It sounds like a system that's from like the 1930s or the 1940s. Don't know. It was good enough then. I don't know. I don't know enough about it to comment more than that. But I would have thought it would have been beneficial to get a more precise, granular tabulation of what people are dying from. Talking about December's A&E ambulance waiting times could be the worst ever. It's the same stuff packaged up, slightly different by different papers and stuff like that. High numbers of admins for flu, rising covy, pressure. More than a dozen NHS trusts and ambulance services declared critical incidents. I don't know I've no understand what the implications of that are. Do they just say, well, it's critical? Then everybody just cares about that. Or does some like bell ring and, you know, everybody has to run around in double time? I don't know. I don't know what the difference is. 38,000 patients waited more than 12 hours for a decision to be admitted. The raw figures, you need to find out some granular on it. You know, is it because you had an ingrown toenail? I'm not suggesting that it's good to wait 12 hours, but I think it's a difference, like if someone has got a life-threatening condition and someone has got, and obviously they do the triage and they come. I'm not a medical person, so I don't know. I don't think it's good just quoting these numbers out of context, though. It's, you know, 38,000, well, no, what was it, 33,000 on a normal week? Or most of the people, you know, sprains, I don't know. It comes back to Rishi Sunak as a full entry. How do they mobilise to? Do they, or do they just? Does the government just do what lots of government does and just hide and just wait till it washes away? You know, the news coming through each day. You know, hope for some disaster somewhere. Another really, really cold spell. You know, another super beast from the super beast. You know, a war somewhere which fires up more, divert attention from it. Yeah. Some celebrity doing some McDuff and something, you know. Oh, well, that's good, you know. We got away from that. I don't know. We've got a Tory senior chairman of the Commons Health Committee, Mr. Brain. He says solving the covy backlogs has to be a national mission for the government. I don't know what that means, a national mission. But you've got to take with the old bag of salt here. Solving the covy backlogs. Now, from saying that, you would think that the 7 million people on the waiting list, it's all due to covy. Let's just get in the time machine, whiz ourselves back to the start of 2020, pre-covy. How many was on the waiting list then? Want to have a guess? Is it 1, 2, 3, 4, or 5 million? I'll make it easier for you. Is it 2, 3, or 4 million? I'll make it easier for you. Is it 3 or 4 million? I'll make it easier for you. 4 million. The backlogs went up from 4 million to 7 million. So obviously there's 3 million that you could attribute to some of it to the covy. But there was 4 million at the start of the covy. There's 4 million. Is that acceptable? But why wasn't there a national mission for the government in 2020 to get shot of this 4 million backlog? Can you see how the covy is like? It's like we can blame the covy. Anybody could see it coming. It's a once in a millennium, blah blah blah, and all the rest of it. 4 million. There's 4 million before the covy. There's 7 million now. That's plus 3 million. We can all do that. 4 and 3, 7, whatever. What somebody should be saying is the rate of this going up or down? Are we reducing this 7 million? But obviously we're pouring more people in. Is it going up to 7.5 million? Is the backlog actually going up, or is it coming down? I don't know. You cannot seem to get the numbers. Maybe the government just doesn't want to announce them. Then you have these surveys. Lots of people saying that the Tories running the NHS being a failure. Blah blah blah. Can any government improve this? National mission. What does that mean? We mobilise everything. That becomes the ultimate priority. Get the 7 million down. spend a load of money on it, do everything you can to do that. Is that a national mission? Will it happen? In my opinion, no. There'll be a few wishy-washy Sunak initiatives, which will scrape a little bit on the edges of some of these backlogs. There'll be some high-profile statements. Yeah, we're going to get another 1 million doctors and 2 million nurses, and we're going to build 3 million more hospitals. Some bland numbers, and in 18 months or 2 years, Sunak will be on the opposition benches if he deems to stay there, which I don't think he will. I think he'll be on his toes in a way, because if he gets hired out as prime minister, he'll go in opposition. He'll hang around there 3 months just to keep face, and then he'll decide that he needs to see more of his family or whatever. Then there'll be a conservative leadership thing, because if it happens the way that most people seem to be thinking, then the Labour government will be in power for 5 years. So that'll be from 24 through to 29. He ain't going to hang around for 5 years. On the basis that possibly maybe he could get back in as the Prime Minister. Obviously, if he gets hired out in next year's election, which I believe will happen next year, he ain't going to be there. So will Labour radically change this? Will Labour have a national mission? Well, they'll come up with a few statements and stuff like that. How are they going to do it, though? It keeps coming back to one thing, realistically, money. The amount of money that you want to put into this to train doctors, nurses, build houses. Or do you want to spend it on nuclear submarines? That's an easy hit. It's always an easy one for people to pick on the military. Look at you spending all this money on the military. What good does it actually do in the country? We've got an aircraft carrier out in the Pacific. What good is that doing the bulk of the citizens in the UK? Oh, well, we're standing up for democracy. What would you rather have? An aircraft carrier out in the Pacific standing up for democracy, or a new hospital? Ask the people. Like I say, it's easy to knock them, but there's lots of other government departments that are spewing money down the drain for little or no benefit for the UK population. And